This is a symposium that really started in thought about a year ago here at the Academy meeting when the International Psoriasis Council and the International Eczema Council got together. We share so much and thought about putting on a joint symposium. We decided to have a symposium that addressed the question of whether atopic dermatitis and psoriasis are two diseases or on the same spectrum. And we put together a program at the European Academy of Dermatology and Venereology in the fall that was so wildly successful that we were encouraged to put on a similar program here at the Academy in the United States. So our question today will be whether these are two diseases or on a spectrum, and that's something you should be thinking about as you hear our presenters today. I'm going to start by just talking a little bit about our two organizations. You may not be very familiar with them, and then you can see why we've come together to do this symposium. The International Psoriasis Council was founded in 2004. It has more than 100 board members and counselors from 29 countries. It is a dermatology-led, voluntary, global, nonprofit organization that's dedicated to innovation across the full spectrum of psoriasis, and its mission is to advance the care of people with psoriasis worldwide through education, research, and advocacy. Its goals are to expand the influence with individual healthcare practitioners around the globe through educational symposia, web-based resources, and preceptorships, to elevate the standard of care for those living with psoriasis with a focus on personalized outcomes, and this is being done through the development and dissemination of evidence-based treatment standards through working groups, roundtables, and consensus conferences, and also to facilitate the exchange of ideas around basic and clinical research and support collaboration between researchers around the globe. And particularly high on its list right now is the Global Psoriasis Atlas, which is identifying and prioritizing gaps in psoriasis research. And the IPC wishes to thank its many corporate members who are listed here. Now, the International Eczema Council was founded in the very end of 2014, and frankly, it was modeled precisely after the International Psoriasis Council. It is now a 12-person board of directors with 77 counselors and associates from 21 countries around the globe, and it is growing. As with the Psoriasis Council, it is dermatology-led, voluntary, a global nonprofit organization led by dermatology experts, but on atopic dermatitis, and similarly focused on moving forward new developments related to research and bringing innovative new therapies to patients. And it brings together experts to identify and prioritize unmet needs in atopic dermatitis research, to facilitate atopic dermatitis research that addresses these needs, to disseminate evidence-based information about atopic dermatitis and its optimal management to healthcare professionals and to the public, through presenting educational symposia, providing web-based resources, preparing white papers, guidelines, and standardized assessments through working groups, roundtables, and consensus conferences. Ultimately, to promote good practices in the care of patients with atopic dermatitis worldwide, and importantly, to collaborate with physicians, scientists, and stakeholder organizations worldwide toward fulfilling the IEC's goals. So today's symposium is really based on these principles of disseminating evidence-based information, promoting good practices in care, and the collaboration that's so important to both groups. And the IEC would like to thank its corporate members who are listed here. Now, today's presentation had some additional sponsorships, and we want to thank educational grants from Celgene, Leo Pharma, and Sanofi Genzyme and Regeneron Pharmaceuticals to support this program. Now, our goals today are to dissect the overlap and differences in the underlying basis for atopic dermatitis and psoriasis, to review new, more targeted therapies and determine if there is overlap in their use, to recognize the need to better subclassify atopic dermatitis and psoriasis based on underlying immunophenotype, and ultimately to assess if psoriasis and atopic dermatitis are part of a spectrum or are truly different disorders. I will serve as chair today with President-elect of the IEC, and that's Emma Gutman, as well as Alexa Kimball, who is President of the IPC. Other faculty will be introduced separately, but will include Jonathan Silverberg, Junko Takashita, Ann Bocock, Wilson Lau, Frank Nestle, Eric Simpson, Joel Gelfand, Thomas Bieber, and Kelly Cordoro. So certainly a star crew who will be presenting for us today. And as you can see at your chair and here, we have a program agenda that will take us through the epidemiology and natural history, the genetics, immune pathway, comorbidities, therapy, and then bringing it together with what's happening in pediatrics.